Well, I think the most important thing to remember is that as we engage with nations around the world, it's about building stable societies that don't have to resort to war to achieve its objectives. Health engagement and building healthy populations and health infrastructure is a pillar of a stable society, just as education is, just as security is. And so it's important to understand and recognize that building a stable health infrastructure that addresses the needs of the peoples of those nations is an important way of building stable societies, and that's why this is important. It's been an undervalued part of our national security strategy. The hope is that if we do it right, we prevent kinetic wars, the open warfare that so traditionally has occurred, that we will reduce the opportunities for that to occur because we have built stable societies. So I think it's several-fold. I think in the modern era, the ability to engage other nations and build a stable health infrastructure is not something that can be done by a single agency or necessarily a single country. The United States military health system has enormous assets, logistically, by personnel, good technology, but we're not always the right agency to pursue to the end building a healthy health system infrastructure in host nations that might need these infrastructures to be built. We need to do it as partners. We need to do it as a whole of U.S. government effort because there are competencies and unique abilities that the State Department may bring, competencies and unique abilities that the U.S. Agency of International Development might bring, or the Health and Human Services might bring with its agencies such as the Center for Disease Control and other agencies. So we need to get smart about how we do this as the whole of U.S. government, and more importantly, how we complement each other. It's important to mature the entire concept of global health engagement as it relates to partnering with other agencies or entities. So allied nations, non-governmental organizations, and most importantly, the host nation in defining the priorities from that nation's point of view. All nations don't have the same priorities or the same health infrastructure to start with. It would be inappropriate to bring in technology that was inappropriate for that particular nation at that time. Sometimes it's much more important to build a public health infrastructure and sustain that and allow the nation to build its capabilities over time. If you don't have a good education system, it does not make sense to bring in a lot of technology that cannot be sustained. The other thing that we need to do is make sure that when we engage, we do it smartly. So one of the things that is always a principle of healthcare providers, speaks to our Hippocratic oath, particularly as physicians, is first do no harm. It's unwise for us to engage with our medical professionals if it's going to displace host nation medical professionals or create a standard that cannot be sustained, and then it builds mistrust of its people against its own institutions. I think the real issue is that as we engage, we partner with host nation, we partner with allies, we partner with the whole of U.S. government. The Department of Defense needs to define more clearly the when and the why and the how of applying its unique capabilities, but then understand how to provide that supporting role when appropriate, and then, if necessary, even leave the scene and leave it to others to develop the sustaining capability. So I think there are 3 or 4 broad objectives of the conference. The first would be to raise to a conscious level the fact that global health engagement and health diplomacy, if you will, the use of smart power, as it's also called, has added value to national security strategy. Not only the national security strategy of the United States, but of other countries, and therefore the world. That the use of smart power can prevent kinetic operations later on, prevent wars. So that's number one. Number 2 is an awareness that in order to do this successfully, we have to mature our concept of partnering and understand better what other nations bring to this effort, what, in fact, the whole of U.S. government brings to this effort, and mature how we work together as partners in a complementary way. The third issue is that out of the conference, a number of action items will come. So we're not going to solve everything in the 3 days we have here, but we're going to lay on the table those issues that require additional work to be taken back to action officers. And if we can catalog those, then we can work our way through the list. One of which may be, what professionals do we want to groom to do these kinds of engagements? What should be their core competencies so that they can engage effectively in the 21st century? And then lastly, we should be talking about the ethical framework in which we engage. So the whole issue of what is standard of care as maybe defined by a Western advanced nation versus appropriate care as defined by an underdeveloped nation, so that we don't in fact leave their infrastructure more vulnerable than if we had never engaged. It speaks to the issue of displacing their professional. It speaks to the issue of providing them with unrealistic expectations or technology that cannot be sustained. So wrapped around all of this is needs to be a robust discussion about how appropriately we engage, ethically we engage, the value system around which we engage, and how we utilize healthcare professionals to their best ability to promote stable nations around the world. And so the Marshall Center is a place where there's a natural marriage for the development and maturing of these concepts. It is ingrained in the original principles for which it was established and the philosophy of George Marshall. It's already a partnership between Germany and the United States that has worked very well for educating up-and-coming leaders around the world. So it's a natural place for nurturing these kinds of concepts and ideas.